All right, at this time, we'll call this meeting to order at 8:30 in the morning. Roll call. I believe everyone is here. Approval of the agenda. Do I have a motion for the approval of the agenda? I have a first. Do I have a second? Virginia? All in favor say aye.
Aye.
Oppose? Then we'll move to the approval. Anything on the approval or on the agenda before I move on? Then we'll move to the approval of the September minutes. Do I have a motion to approve the September minutes? Julie? Do I have a second?
I will second.
Okay, all in favor say aye.
Aye.
Oppose? Any discussion on those minutes? Then we'll move to any citizen input. Nothing at this time. Then we will move to COVID. Cindy.
All right. Can everyone hear me? No? This is on. All right. Is that better?
It seems very weak, doesn't it?
Yeah.
That's what I was holding it because I felt like no one could hear me. Can you hear, Linda, or no?
Yeah, it's better now.
Okay. I just wanted to give you an update on where we're at with COVID within the county. So as of Friday, we had 1,289 cases. Of those, 119 were active. I can tell you that over the weekend, we probably have seen at least 35 additional cases add on to that. So our numbers continue to go up. We've been doing a little bit better, in my opinion, than where we were at a month ago. So our numbers are kind of leveling off. We average about 15 to 20 a day. And we've been holding our own with that. As far as contact tracing right now, we officially have 8 contact tracers in our office, including myself. So it's our original staff, minus Deanne. She's the only one, I think, in the office that isn't doing contact tracing. And then we've hired 4 additional contact tracers. We've hired Christy Shaw from Kewaunee. We have hired Mary Chris Dvorak. We have Sydney Helson, which is our Bellin College of Nursing student from this semester who chose to stay on with us. And then we also have Margarita Thomas. So between the 8 of us, we are able to complete our contact tracing every day. We are still contact tracing all positive cases and all contacts. And we're the only county in the area that's doing that. Most have given up on the contacts and are simply doing their positive cases, and then we'll talk those positive cases through household contacts only. So we have been fortunate that we've been able to keep up with our caseload, and we're getting that done every day. So I'm proud of our staff for that. As far as testing, right now we have 3 sites in the county that are doing testing. So we have Door County Medical Center in Algoma that tests. We have Bellin Health here in town, Monday, Wednesday, Friday afternoons that test. And then we also have Prevea in Kewaunee that tests 5 days a week through their urgent care site here. And to my knowledge, all of those sites will remain open. I actually was in Green Bay last week at a clinic, and they told me that several of the Brown County sites will be closing down due to weather. So we aren't going to see the sites on East Mason Street for Prevea and some of those big tented sites open anymore. What they're doing is they're opening the Brown County Fairgrounds for a regional site, and people will be able to drive in and do testing at the Brown County Fairgrounds. In addition, if you've been watching the news at all this weekend, our universities have all received additional tests to do some antigen tests, which are rapid tests. So they will have testing available at each of those university sites. And I believe those are open to the public as well. They're not just for students anymore, but those have like about a 15-minute turnaround on them. You have to be careful with antigen tests. They do give a false positive on asymptomatic people sometimes. So if we do get positives off of those, we are running a swab to back that up to make sure that it's an actual positive case. But we still have a fair amount of testing going on right here in Kewaunee County, and we've been able to keep up with that. As far as vaccine, so we've heard through the state that vaccine will be coming. They're hoping sometime by the end of the year, or the beginning of 2021. They will be providing us with that vaccine free of charge, as well as all supplies needed to administer it. So what we will be doing then is setting up our testing sites and providing staff for the administration. Last week, I did file the contract with the CDC to be an administrator of COVID-19 vaccine. So you have to file a separate contract. Anyone who wants to administer it does. It's not going just to our normal VFC sites as we are typically for the Vaccine for Children's program. So that was a separate contract for us. It will be a 2-dose series, just so you know, given 28 days apart. And the complication with the early doses that will be coming out first are that they need to be under a deep freeze. So therefore, some of that will require dry ice. That's just another level of complication for us because we don't have that capability, nor does any health department really. So I think what you're going to see is that we'll have a shorter shelf life on our vaccine than what we would typically have. Once we usually get vaccine, our shelf life is at least a year for most doses that we get. This one will be closer to maybe 1 to 2 weeks that we'll have to give, and we'll be getting it in small increments until they get a more stable vaccine out, which they tell us will be later in 2021.
Is that typical for a vaccine to be that short of a shelf life?
No, but that's because we don't have the capability for the deep freeze. So we'll be able to put it in our freezer, but anytime you don't store it at the temperature that they require, your shelf life shortens. So for instance, right now, our only one that we keep in a freezer would be varicella for chickenpox. And if, say, our freezer went out, we call the CDC, they estimate the time that freezer went out, and then they'll shorten that shelf life and say you have 2 weeks to use X number of doses. Yeah. It is going to be prioritized, so we will see healthcare workers and we will see senior citizens at the top of the list. We're also going to see our residents of CBRFs, skilled nursing facilities and such up there as well. Yeah. So that will go first. General public and general population will be in a second round.
Will they also consider people that are at risk
Yes.
in part of that category? So even if they would be younger, but they're high risk?
Correct. So if maybe they had some kind of respiratory illness or something like that, that puts them at a higher risk, they will be categorized that way. As far as our schools right now, so the schools are holding their own with the COVID. We have not seen huge surges within our school buildings. We've been very fortunate at that. We monitor all the cases. We do have a spreadsheet for each school district so that when they get a positive case or a contact to a positive case, they know that we have done the tracing and they have a date that that child may return to school. We do the same for staff there. We do have a couple classrooms currently that are quarantined. Most of those classrooms that get quarantined are either classrooms where they're younger kids and it's a little bit harder to control that 6-foot distance between them, or we have had instances where, say, like a home ec kind of classroom, because they've been up and cooking and going into supply rooms and different things, have been quarantined because they've been moving around the room. But otherwise, right now, our schools are okay. I believe they are all back in session. Kewaunee here in town is doing, yeah.
It's where they go to school, a group of kids each get a break. So 2 days in, 2 weeks in, 1 week out.
Yeah, and they're
It's
rotating
ABC.
different groups. So they have sections of the school that go on different days. Luxembourg Casco is in person. completely. Algoma is in person completely. I am actually meeting with Luxembourg Casco after this on their after Thanksgiving plan. So each of the schools has been asked to look at those holidays and give some thought as to what they're going to do if they see a surge due to the holidays. Some of them may choose to go virtual for that 4-week period between Thanksgiving and Christmas. Some may not, depending on what our caseload is at that time. As far as outbreaks in the county, I just want to touch base because we've had a few bigger ones, and we had a significant one in a CBRF, which virtually, I think, has affected just about every resident in the facility. They tell me that there may be one left that hasn't tested positive yet in that building. Some staff as well has tested positive in that facility, not all. But we have worked through that, and for the most part, I think we've rounded the corner now, and we're seeing a little bit of improvement there with the cases that are left that are being monitored. Unfortunately, over the last week, we have had 2 more facilities that have had outbreaks. These are all CBRFs, which are community-based residential facilities. So, we're gonna see that happen, and for the most part, they've been in a lockdown on visitation. So I think it's probably coming from either staff coming in that have tested positive, or possibly someone who went out. The staff are allowed out to go to appointments. So say they went to a doctor's office or a dentist's office or something like that. They do run that risk of coming back and having been exposed while out.
Have there been any hospitalizations?
Yes. And due to those outbreaks, a significant amount of deaths for our county as well. So if you've looked at our numbers in the last couple of weeks, our death total has it's at least doubled from where we were at a month ago. And the one CBRF facility, I think, had 4 deaths come out of that one facility. Yes. So we've seen an increase in hospitalizations countywide. We've seen an increase in deaths countywide. I think our funeral homes would agree on that fact because they've been busy. The hospitals are busy. It's out there. So, what our office has done is we've done our contact tracing, obviously, and then we've continued to share the message to, stay home if you're feeling even the slightest bit sick. It's minimal symptoms for some people, and they don't realize that they have it, but they can spread it to others quite easily. And we're really emphasizing with these facilities to not let anyone work who is even slightly symptomatic.
So are they going to look at altering their protocols if they've had 100% of the residents are positive and either, survived or didn't, but they should be technically clear from...
Well, yes, but then any new resident coming into that facility would not be in that same boat, and they still have staff that are, that haven't tested positive, so their regulations remain the same. So they will go with obviously encouraging all people who are sick to stay home. If a resident is sick, they do a quarantine in their room until tested. If a positive comes back into a facility, then we're testing that entire facility. We see how many we have as a whole, both with staff and with residents. And then once we get those results, they test once a week until the entire facility is clear.
So I guess I'm just curious, at what point are they going to change protocol that they'll be able to get visitors and things like that? You've got all these poor folks that are isolated and quarantined for essentially the rest of their life.
Well, and so we've made some plans with them, and once the facility is free and clear of positive cases, then they can go back to having limited visitation. If they have been able to, we've encouraged them to set up, outside is where they mostly have been visiting for several months, but with cold weather coming, we're asking them to pick a room that might be close to an end doorway that can seal off. You know what I mean? So that they're not having people walk through the entire facility, that kind of thing, to use for visitation. Visitation is limited to a 15 to 30 minute visit with family, and they can do that X number of times within a month or whatever it might be. So they do have that. Compassionate care is still going on. And what compassionate care is if you have a family member that is nearing the end of their life, thought to be dying, then they can go in and they can visit with that. However, we really encourage people to still maintain their 6-foot distance, do the proper PPE and masking, because otherwise what happens is if their loved one dies and they don't follow those protocols, they are considered a close contact, and therefore there can't be a funeral for 2 weeks because the family is now in quarantine and can't attend. So there's a lot to think about with all of that. And, even our clergy has been put at risk because they're called in for a lot of those situations. And then, then they go back to their own parish and all of a sudden they're putting others at risk too. So it's a lot.
Okay, I'm going to ask a question. So with COVID, what about the flu? Like when they're coming in and getting tested for COVID, is anybody running swabs on influenza?
Yeah, a lot of the people are getting swabbed for both. So we're seeing test results on both.
Okay.
We haven't seen a spike in flu yet in the state, but the state watches that very closely.
Okay.
Cindy, with Door County being adjacent to us, what is your take on their numbers with 400 and some active cases? What's going on there?
Yeah, so Door County has seen a big surge recently, but they are in a different situation from us. So they still have seen that fall tourism and the fall colors group going up there. So they have a large number of people coming in. Some of those people, the numbers should go out of state, obviously, and get tracked back to where they're a resident of, but they still have all the tourism coming up there. So I think that's why they are seeing a little bit more right now, because it affects their own residents, because tourism is so big. I can't answer on their behalf. I haven't watched as far as their facilities, but they may have seen some of those facility outbreaks as well that we similarly did. And we have to remember that Brown County's numbers are still high, and we kind of all get trickle-down effect from Brown County as well, with people that work out there and that kind of thing.
So I have one more question. So last year with the flu, there was like a type B and a type A,
Correct.
right?
Yeah.
So now the flu, you haven't heard much about it. So do they think that this COVID is like a flu that took over, kind of like with the influenza, that it just has a name to it, where the flu was an A or B? Because it's like over the years, influenza is just, October comes, kids' noses are running,
Yep.
And so it didn't go away. It's out there.
Right.
So is this just something that came in and overtook and is categorized with influenza, and it's something that's going to, next year we're going to have a strand of this and a strand of COVID, or another name of COVID? Is there going to be another strand that'll come off of COVID?
They don't have the answer for that yet, but they are doing research on that. So they are not sure if they're not sure on that immunity level yet. So right now we know that people are staying immune for at least 90 days. And that's why when you get it, you're free and clear for 90 days. But if you get it after that 90-day period or get exposed, you would have to quarantine a second time. Okay. So we don't know that immunity level. And we don't know if when this vaccine comes out fully, because it's in such a rush, if it's going to be lifetime immunity or if it will be similar to flu in that you get it yearly. Influenza, how it works is they watch it and they trace it globally, and it changes slightly every year. So they put the 4 most common strains of influenza into a vaccine. So there are 2 A's and 2 B's in each vaccine to protect you from the 4 most common flu. And so right now with COVID, it's just entirely too new, and I don't think they have that answer yet.
And that vaccine's effectiveness is not very high either for the influenza, is it?
It just depends on the hit. So if we are hit with, like a Wisconsin, and that's the primary one, and that's what's in the vaccine, the efficacy will go way up. But if the primary flu that we see here isn't one of those 4 strains in that vaccine, then the efficacy of the vaccine dips slightly. And it depends where you're at in the country, because certain parts of the country are exposed to different parts of or different strains of flu. So it's all dependent on what strain of flu you come in contact with.
And isn't that why last year there were so many kids getting sick, but they had the other influenza, like it was a different strand?
What we saw last year in the flu season is that typically influenza A hits the United States first. And then we see cases of influenza B spike somewhere around late February, March, and April. And we had the spike of B in fall. And so all of a sudden we saw all these kids sick because kids tend to be more prone to catching influenza B than adults are. So we had a reverse last year in flu. Yeah. That's all I've got for you on COVID.
All right. So we'll go to grant update, but then with the flu update, did you do that or
Not
you want
yet.
to?
No,
Okay.
I've got a
Okay.
lot.
I didn't
Yeah.
know if you, because we kind of jumped a little bit, Cindy.
Yeah.
Okay. So let's go to the grant update and budget amendment.
Yeah, so there was a resolution that went out at last month's county board that you guys approved, and this came out after our ability to get this to you in time. It was released like a day or two before county board. So I just wanted you to have the numbers as to where our grants came in. And the reason that you get this in November, yeah, I know it's late because we only have a month left of the year, but our grants change throughout the year. And so our final numbers for public health on our grant totals really don't hit us until fall. So, and then we do all of our adjustments. And the big thing with where we were at, we went up a little bit in most of our grants. With children and youth, we got 200 more than what we thought we were going to. With WIC, we were able to apply for a peer counseling grant, which added an additional 6,000. And then our grant came in a little higher than what I had predicted. So we actually ended up with about 11,000 more in that grant. We ended up with $53 more in lead. We ended up with about 2,200 more in prevention, and some of that prevention money came out because of COVID. So prevention gave us additional dollars and said, here, we know you're busy, keep doing what you're doing and use it for the COVID efforts. We ended up with about 1,000 more in the vaccine immunization program. And then the last two categories were specific to COVID. So that FEP COVID on the very bottom, we ended up with a grant equal to what they give us in preparedness. So we got $35,000 more than what we thought in there. And that one will carry over. It goes for this year, but it will carry over to next year as well. And then the contact tracing, you're not seeing true numbers on the top of that. It's confusing. You're seeing what we've used at that point. We got an additional 176,000 something given to us if we need it. So basically you bill that grant and they will reimburse you, but they're not giving you that lump sum like they typically do at the start of a grant where they say you have this much. It's however much you're going to use. And we will probably end up using all but about 25 to 30,000 of that. So we just did an estimate last week, sent that into the state as to what we thought we were going to do. Other numbers in that contact tracing that aren't in there, we got money for testing as well. And we also got money for preparedness planning. And so those things will be spent down as well. Do you have questions on this resolution? It's just always, I think we're the only probably department in the county that ends up giving you these numbers at the end of the year because they finally get finalized sometime in October.
So this will be this resolution?
Yeah, that went through county board last month.
This is an old one though.
If we would have met in October, we would have had this resolution before it went to the board.
Oh, actually, it does say on this 18th day of June. I'm not sure if we just got an old copy of what Jeff sent out.
This one we passed in
2019
October.
And there's Lee Luft on there.
Oh, yeah.
Uh,
This page that you got is correct.
This is.
This is, I'm not sure what
Scrap
this
paper.
is.
That's the new
You have
resolution.
the new one that was sent out maybe with county board? Yeah,
Yeah.
maybe that was a mistake
Yeah.
as an attachment.
Okay.
But the actual Public Health 2020 grants resolution notes are correct.
So it's gonna be what's on the bottom of this page, that Paul states there's $47,000 in additional,
Correct.
okay.
Yep, in addition to the budget that was approved for the first of the year.
So we need a motion to recommend adopting that resolution to the county board? If so, I'll make that motion.
1 second, let me get back to my stuff because I'm moving around here.
I think it already went through county board. I think
went
it was,
through?
it went through last month.
So this is just a.
You just didn't get a
FYI.
chance to see it because it came out like 2 days before county
And
board.
finance approved it, so it's
Correct.
on the
Okay.
budget, so I don't think we need anything.
Got it.
Correct.
And you said it was going to be late too.
Yes.
didn't you? Okay. So is there any more questions on the grant update or the budget adjustment, amendment? Then we'll move to the flu update.
So flu season is in full swing, and I just wanted to let you know that we have been busy with that. So we've had numerous clinics going on throughout the community. We have done 244 adult influenzas so far, and we ran those out of our office as well as separate clinics at the Anape Town Hall and at the Luxembourg Village, at the fairgrounds at the Expo Center. So we were running clinics throughout that. And then we also have done 497 vaccines to the kids within the schools. And that's been a little bit different for us this year because every time we schedule a clinic, they go virtual and it's very frustrating and we have to reschedule. So we're not done yet. We had ordered 600 doses. We still have a little over 100 left in our fridge, and those will be given out between probably Kewaunee. I think they have a third section that has been out virtual, and so we need to get in when that group is in the schools. Luxembourg Casco, every time we go there, they've got classrooms that have been quarantined as well, so we go back and do little sections of the school, and so we do have a few left between those two school districts. But otherwise, every parochial school was offered vaccine and did accept, and we went into the parochials. We've been in all the buildings. So we should be close to getting our full goal done with influenza. And like I said, cases have not really spiked in the state yet. That's typical, though. Wisconsin as a whole doesn't see influenza spike till usually December, January. Questions on influenza? All right.
Okay, so let's move to any other question or any questions on that from anybody else. Then we're going to move to the September monthly report. Cindy.
All right. So in front of you, you have the September monthly report. Our contracted caseload for WIC has been holding close to its own. So, I mean, we're hitting about 200 to somewhere between 200 and 210 for our caseload there. So we've been able to meet the needs with the WIC population. They're still coming in for appointments. That has not changed. As far as immunization, the September numbers are a little bit lower. October, you'll see, will shoot up on the next report simply because we hadn't done as many vaccines out in the community, but that number goes up with October because they've been busy. As far as communicable disease, reported cases to us in the month of September were 1,154. Keep in mind that we do a total of 189 a year, typically. So 1,154 came in September. 256 of those were confirmed cases, and just about all of them were COVID related. But we have had a few other things popping up. So we've seen a few more of our GI illnesses coming out. We've had a couple of the STDs popping out, and we've had a little bit more hepatitis in the last month or two. And then if you look at October, That was a doozy. Same thing for WIC. We're holding our own there. So we still are at about between the 200 and 210. We've done 739 vaccinations in the month of October. And communicable disease wise, we had 2,677 communicable diseases come into us. 653 of those were confirmed, and just about all were COVID there as well. So we've been busy downstairs with that. Any questions on any of the school visits or activities, conferences, that kind of thing that you see on the reports?
Okay, so
I have a question,
go ahead, Jeff.
Cindy, regarding the communicable diseases. So we've had obviously a big uptick in the reported cases every month. The suspected and
Yep.
confirmed, and then the not a case. So if you look at the not a case, those are obviously at the highest level of all the numbers. What do those typically turn out to be? So obviously these people were symptomatic of some sort?
Correct. So irregardless of what disease it is, if they run something that happens to be a test for a category 1, 2, or 3 disease in the state of Wisconsin, we'll get those test results. And it is the health department's job to look at each and every one of those cases, verify that yes, it is negative, or this is questionable here, maybe we send them back in. So for instance, if we get a hepatitis case and they meet some of the criteria, but there's still some questions out there, we'll send them back and have a more definitive test done. And then we do follow up. If it then comes back negative, they're deemed not a case. If it comes back positive, then they flip over to that positive category. And it's the same with the COVID thing right now, where we're getting every single one of these test results into us. We look at those test results, and then we make sure that they are either positive, negative, every inconclusive test, or inconclusive, I'm trying to think of the other word that they use, but they have 2 questionable categories, probable, they'll look at that, and then we look at each one of those and we make sure that they've had the right tests done, or do they need a follow-up test. And that's how that works. Probable cases on here are a little bit interesting. So those people that are listed as a probable, for the most part, all of those are COVID, and they live in a household with 1 or more positive people and have every single symptom that the positive people have, but their test result came back negative. A test is just a snapshot in time. So you can test negative at 9 in the morning, and by 3 o'clock in the afternoon, that test could switch over to positive. And so these people obviously aren't getting tested around the clock like that. So if they meet all the criteria and have the fever and the body aches and the headaches and the cough and everything else, and everyone else in their household or somebody else that they live with in the household is positive, they'll be listed as a probable case.
So with the reported cases, obviously you're looking at what, 95% are coronavirus?
Mm-hmm.
So if it's a reported case, that means I go to Green Bay, I broke my arm, I get tested, I have symptoms, but not tested. I would be reported back to the Kewaunee County Health Department as a suspected or reported
Suspect case until we deem it either positive or negative. Yep.
So there's that many sick people that obviously have some sort of symptom. There's 2,677 in 1 month, and yet the majority are not coronavirus.
At the time that they were tested.
Yeah.
Yes.
Interesting.
Now, some of those people, might go back and get retested or things like that. When we retest, if they are then positive, they come off of our negative list for the numbers that you see printed every day in that daily report. Yeah.
Okay. Thanks.
Yep.
Let's go back here. All right, so you did September and October monthly reports. So now we're going to move to your agency updates.
Yep. So a couple things with the agency updates. We have received some more funding. It is called ELC, which is an epidemiology grant that will carry us from January of 2021 through November of 2022. 22, and that's meant to help pay for the contact tracing that's going on in the counties. So that grant was a base grant of $250,000, and then based on population, you got an increase. Ours came out at 305. So we'll be getting that, and that will carry us through 2 years. In addition, this year they had given us a tiny chunk of that at 13,000. That will be added on as well. So we're at 318,000 roughly to carry us through for the COVID efforts that we're doing. And then, just so you know, that adjusts what we spend in the levy, because when we get additional grant funding, our levy funding our levy spending goes down for the health department. So we will always spend our grant funding first and hold off on our levy funding. So even though you just are going to go, you're actually going tomorrow night to approve that budget, and it says that we've requested, 100 and some odd thousand for the health department for a levy, we will not use all of that. Okay. I just wanted to let you know a few other things that are going on in the health department. So we did receive our beach testing results for the year. And at the Kewaunee beach, we did 53 samples and we had 1 advisory issued. And then at the Crescent Beach, we did 53 samples. We had 3 advisories issued and only 1 closure. So
Is there any idea why? Because it seems like years past, we had our beaches closed
all the time.
all the time.
Yep.
So what's changed in the
So
lake?
we've changed a number of different things, but there was a lot of upgrades and work that were done on the beaches through the DNR and through different grants that were out there to increase plants in some places and reduce drainage in other places and different things. And so through that mitigation that took part on our beaches, we've really seen our numbers improve. So for probably the last 4 or 5 years, our numbers have really been outstanding as
Does it
far
seem
as that.
consistent up the lakeshore? Or are we unique because of the proactive approach we've done to the beaches?
Well, we're unique in that it's working very well for us, but we also have less beaches being tested, so we're smaller. Door has a few beaches that really still test out high, but their population at the beaches tends to be a little bit higher in some of those beaches than what we have. Although I have to say Algoma's Beach was nuts this summer. There was a lot of people there. And then when you go south, Milwaukee, or closer to Milwaukee, those beaches tend to test a little bit higher as well.
Okay.
Yeah. So our school health programs are wrapping up. We were able to get into all of the schools, in the parochial schools, and do all of our hearing and vision and scoliosis testing for the fall. As far as our public schools, most have chose to hold off till spring. They're hoping that if there's a COVID vaccine that comes out, it will help with some of that. So some of our public schools have held off, but for the most part, we're on track with where we need to be for school health. We also had the PALS program that started up this fall. That was our senior exercise program that we had received extra funding for in spring, and then it got delayed. We brought it back in fall, and we got a few sessions in, and then the numbers spiked in the county, and because of the population being at the age that they are, we chose to shut that down for fall. So we're going to try to bring that back again in spring. But the state has reassured us we got more in than any other county that got that grant. So we at least succeeded in some ways. And the people have really enjoyed the program. Just does a fantastic job with it. It's a 10-week exercise program to try to encourage people to make some significant life changes. So it's been going well. And then we also have the Giving Tree coming up in the next month or so. I think in about 2 weeks we'll have that tree up. That Giving Tree is in honor of Sarah Millay, who is a former employee here. And so we run a food drive and over the holidays. And so we're going to continue to do that. There was some question whether we should or shouldn't. And I think what we've at least noticed with the back to school program is that the community was incredibly giving this year, and that they tend to give a little bit more monetary donation and less in person, which is perfectly fine. So we will keep taking those donations. at our main office downstairs. And then about a week after Christmas, we do a delivery and we drop that off at all the food program or the food pantries in the county, and we split it up evenly among them. Anything else that you can think of? I think that's it. Those are the updates that we have. Questions from anybody? Then quickly, in front of you is the financial update. So it's the bigger one, not the one with the green line in it. And as you can see, this is September's. October will come out probably next week. But we are on track with all of our spending. What I can tell you right now is that Deanna and I have spent significant time over the last week or two figuring out exactly where we are with each of our grants and figuring out what needed to be spent down. That grant money will be gone by the end of November, with the exception of WIC, because Rachel is paid full time through WIC. So we have that one will close out in December, but otherwise all grant dollars will be spent down. And then as far as the COVID spending, we will spend the majority of our planning dollars, which was $30,000, will be down to maybe between 2 and 5 left in that one. And testing is a little bit tougher because we don't do a lot of the big community testing that other counties are, but we will be spending some of that money down. And then our contact tracing, like I said, will go down to roughly between 20 and 30,000. What is left in those grants then just simply goes back to the state and is redistributed to counties in need for those specific efforts. And we will probably give, like I said, a good portion of levy back here. You'll see that when you look at the 54100 and the 54106, those numbers are not spent down nearly as to what we have asked for in those budgets, and that's simply because we're using the grant funding instead of the county levy funding.
And with that grant money that you talked about, I think you said till 2022? If we don't use it, the same thing, then whatever is left goes back
Correct.
to. Okay.
Yes, and that's a new one that's starting up January 1st. Yep. And then as far as our consolidated contract, which is our basic grants that we get every year, the maternal and child health, the lead, the immunization, we're on track as far as all of those go to get level funding that we received this year, again in 2021. We did not receive any cuts.
All right, any questions? Then we'll move to the travel request
There are
and
none.
approval, which I assumed.
Yeah.
Overtime.
And then the overtime report, I did ask Paul in finance to run you an overtime report. I think it was on your desk. It has the green line through it. It's a report that covers all of the county. So I just highlighted the one line for you for public health, so that you can see so far. This was for October what we spent.
And is this probably COVID, right? The overtime hours?
All overtime right now for the health department is COVID, and it's all being paid for through COVID contact tracing through that grant.
Are there more grants that you're hearing about on the horizon, or not sure yet?
For us, no, not necessarily. I think ours is still going to continue through that CARES Act that you hear so much about, and that's where we're at as far as our grant.
Okay. Any more questions on that? Then we'll look at, next meeting date. I believe we did December already, or no, we didn't. I thought we did.
No.
So are we looking at December 7th? 7th.
No, that's
No, it's actually not the first Monday.
be the
The
14th.
14th.
Yeah.
So let's look at December 14th. Is that going to work for everyone for 8:30 in the morning on Monday, December 14th? All good? And I apologize, Deanne, I thought we had it. So this is the one, if you can let the veterans, okay. So December 14th at 8:30. Any other subject, any other questions on anything? I just have one thing to say. Just remember, the rest of us for the board, we don't have the meeting with the vets today. I assumed they left you snow. That was what they were going to like. Okay. So I just wanted to let you know again. And I'm going to put down that on the 14th of December, we'll have the 8:30 health meeting and then we'll follow with the vets. Okay. So if there is no other questions, then yes, Linda.
Cindy, I just want to know what happened with that Board of Health form that we were supposed to watch online. And I
Oh.
couldn't because I was working that night. Did they tape that? We can,
To my knowledge, it was not taped. Jamie told me that they didn't think that that was going to be a possibility, which she's the head of Badger Bay for that. Was anyone else able to watch? The Board of Health Waldab offered a Board of Health training in September. I had emailed all of you with that date. It was just something that you could watch and informative for you, basically. I can see if there were minutes or anything put out after that or any kind of summary.
So you'll check on that and, okay. Any other questions? Then if I can have a motion to adjourn for 9:15, Virginia, a second. Kathy, all in favor say aye.
Aye.
Oppose? This meeting is adjourned. Just don't say anything, we're live yet. Thank you, Deanna. Okay, thank you. And now we're just going to assume we'll move forward to that next meeting.